Hello, and welcome to this new episode of CIO Leadership Live Middle East. Today, we welcome one of the faces of healthcare IT in the UAE, Dr. Mubaraka Ibrahim, acting CIO at Emirates Health Services. Salam alaikum.
Alaikum salam. Hello, Andrea.
Hello, Dr. Mubaraka. It is a pleasure to have you today with us. And as I said, you're one of the faces of healthcare IT, so I'm pretty sure this interview is going to be so interesting. And there are so many things that I want to discuss with you, but especially about you and your role and healthcare, because everything has changed after COVID, especially in the healthcare sector. So as a CIO, I would like to have your feedback about how the healthcare systems have changed after the COVID-19 pandemic. What role does digital health play in this transformation?
Okay, first of all, thank you, Andrea, for having me. Now, regarding your questions, how the healthcare system have changed, after the COVID. Actually, when the COVID happened, it led to unprecedented disruption in the healthcare. As an industry, we have the greatest need to perform our full potential, in the healthcare, digital healthcare, and that happens that it spurred a demand for the digital health or the digital transformation, especially in the diagnosis area. And the solutions such as the telemedicine that would assess the patients throughout the treatment process. Now, when the pandemic happened, made the digital health transformation something that is essential and a need of the hour for the patients, for the providers, for the hospitals, for the physicians, and which is actually will support also the payers and the entire ecosystem in the healthcare. Now, one of the major things that happens after the COVID-19 is the virtual care, which is actually have emerged tremendously, and it's a significant platform for remote consultation, as everybody knows. Now, for the use of the telemedicine services, actually it increases 38x during and after the COVID. So we have seen that the venture capitalists invested around $4.3 billion in the telemedicine alone itself in 2020, which makes it the leading investment profile in the healthcare, in the digital healthcare. So if we talk about how the COVID opened up the arena for new use cases in the digital health, it's actually enabled technology companies to invest heavily in the digital transformation. Now, when I say that, because I mean it is aiming for virtual care more, and also when you talk about the global IT, the spending is expected actually to grow 4.3% in 2023. And according to the studies that we have seen, it is now reaching $4.7 trillion, reflecting the commitment that is currently in the digitalization. Now, when we talk about how the digital health has changed, now you've seen even the investment from the hospitals. So even the hospitals now, what they have done is that they have actually approximately made 5.9% of their budget to be allocated for the digital transformation. So, I mean, this is how we've seen the spur of change in the digital transformation after the COVID-19.
And Dr. Mubaraka, how do you envision customer-centric technology shaping the future of digital health?
Well, looking ahead with digital health technology advancement, we see that are going to be having several trends that we're going to be having a positive, I'm positive it will be around like the AI-driven diagnostic tools that will drastically improve the personalized healthcare and collaboration between healthcare providers and patients. So speaking of trends, the first key trend that we're going to be seeing is going to be feasible is going to be the increasing reliance in the mHealth apps. So now currently you've seen that a lot of apps now is being introduced in the market, and it's really depending that a lot of the patients are utilizing these apps to track their health. So when you talk about the global mHealth investment or the market actually, currently it is being valued about 56.8 billion US dollars. And the projection actually for the market expand, the compound growth rate that's going to happen is going to happen between 10.8% between 2023 and 2030. So that means that the mHealth apps will enable consumers with a complete virtual experience. When I say that, it will be more dependency on the mobile apps. Now, the second increasing is the embracing of wearables for the consumers. So you've noticed that a lot of the consumers now are using wearables, like, that tracks their health. Like, it will actively measure certain vital signs for the individuals themselves. So, I mean, with this, it will enable also the integration that will happen with the digital health records. And eventually, it will enable the organizations and the providers to detect, early the symptoms and the diagnosis. And we've seen that this trend actually will also enable something called hyperanalyzation in the healthcare. Because currently, the way we are providing the services is more of a service, but is not linked to how the consumer or the patient wants it. So with this advancement, we will see that there will be a major jump into the hyper-personalization. A third key trend that we're going to be seeing it happening is for the Gen Z, as everybody knows, and the millennials, which is the youngsters, they are taking over the world currently. We are seeing them that they are trusting the virtual, space. So for us, they will be the first online that they will be utilizing these type of, healthcare services, which is the virtual healthcare services. So we're expecting that there will be an increase actually of how these new generations will be utilizing the virtual care. So what we are seeing currently is around 32% of the Gen Z and 43% of the millennials are opened for using the virtual care. And there will be the increase from that side. Now, one of the, last but not least, one of the trends that we're also seeing is the omni-channel, which is the virtual omni-channels. This actually is a trend that is gaining a huge consumer adoption, which is that we can see that various digital health tools, for the health needs. So they will be having apps that tracks their health, their fitness, all these type of things. So the omnichannels are increasing. And with this, we are actually going to be able to embrace more of digital health virtual care implementation. So if you talk to me, I think in conclusion, and I believe that the customer-centric technologies will enable us, and the healthcare providers to deliver a personalized healthcare experience tailored to their specific needs. And this we can actually achieve an effective and focused patient care for the higher patient satisfaction.
Well, I think all the topics that you were saying are amazing. You were talking about new generations, Gen Z, but I think we need to talk about new technologies, in this case, Gen AI, because every time I attend an event, this is a hot topic. Everyone is talking about it, but I would like to discuss with you about the potential of Gen AI in health services delivery. Do you foresee it making a significant impact? What risks do you anticipate in the adoption of Gen AI? And what strategies would you propose to organizations that are planning to implement Gen AI? Too many questions.
Well, for the Gen AI, or we can say artificial intelligence, actually we see there's going to be a huge change in the customer experience. And actually in 2032, the projection is that the generative AI is projected to reach around $118 billion, with healthcare spending at $22 billion. So when we talk about machine learning modules, pertaining to a huge amount of data that can, that can produce diverse content, which is including conversations, stories, images, videos, music. Healthcare requires actually reliability and accuracy, which is why we are actually now developing specialized algorithm for the medical, generative AI. And with this, there will be a promising advancement, especially in I'm going to give you examples like the Google Med, that is now currently has reached 92.6% accuracy. So there is actually a trend that there is a huge focus in be doing the machine learning and the data analytics and the software optimization only around healthcare. And with this, we'll be implementing, they will be actually implementing a Gen AI strategy, and there will be a huge investment, in the management and also in the analysis tools. And we are seeing that we'll be leveraging a large, and diverse data sets areas in the healthcare.
Thank you, Dr. Mubaraka. We talk about your ambition about customer-centric technologies, how the healthcare sector has changed, especially about after COVID, Gen AI. But you are the CIO of Emirates Health Services. So what are the challenges for a CIO in digital transformation, not only in the healthcare space?
Well, CIOs actually, I can say that they are the one who's having the major huge challenges in any organizations, because we'll be leading in the digital transformation. And the idea that when you talk about digital transformation, it's a whole change. It's not only a technology part change. So that is why most of the CIOs are seeing huge challenges when it comes to a successful digital transformation journey. Because, the approach is, it has the three major pillars. It has the people, the process, and the technology. And the technology actually currently, as everybody knows, it's a catalyst for digital transformation. And it's a stack that will align with the business objectives and the cost structures and the customer needs, and it will integrate it with the existing systems and scalability. Scalability for are also crucial in that part. So what I can say is driving digital transformation by itself is one of the major challenges for the current CIOs. And also, to overcome these hurdles, we can see that a digital ambition would be to speak and tackle these type of challenges when we talk about the people, the process, and the technology. So we need to look at certain mechanisms for each of the CIOs to be able to manage these challenges. Like that they should be having a talent optimization, which is very important for the CIOs, which is automating business processes so that the subject matter expert, to focus on the core functions. And another area is adopting a continuous modernization approach, which means that they will need to identify and eliminate the old technologies barriers and the friction points. And this actually will lead into a continuous modernization programs and also a culture and continual improvement in the organization itself. Now, going forward, also, one of the things that the CIO should be able to manage is identifying the new funding opportunities, because now we should be moving out from the funds are coming only from one direction, which is maybe the organization itself. Now we should be able to open different areas for funding so that we'll be able to manage to adopt the huge digital transformation in the organization.
Mm-hmm.
And also, we need to be ready for the culture change, because we have here to have a successful digital transformation organization, they need to establish a change-ready culture. And this will not happen in silos. It will be actually a collaborative effort between the business leaders and the organizations as heads and departments and the people in the organization itself. I mean, I'm seeing it going forward. This will be a successful digital transformation, which will happen in any organization. But if that path is not being adopted, I think any CIO in my place will be having the same challenge all over, and we will not be able to reach the digital transformation we're looking for.
I do agree with you. Absolutely. Dr. Mubaraka, we were talking about Gen AI, but I think we need to talk also about sustainability, especially this year that COP28 is taking place in Dubai. How can digital health contribute to the sustainability of healthcare systems?
Well, the sustainability in the healthcare is huge, or I can say a vast, there is a lot of areas in the healthcare that we can contribute in the sustainability. Now, the UAE government has developed plans and strategies actually to reduce like greenhouse gas emissions to net zero by 2050, and transition the whole UAE country to a climate resilience green economy. Now, going forward, how the healthcare or digital health can contribute in that. Now, we can see, like in the COP28 conference that will happen in November 2023, the government has designed a full work frame for the year of sustainability. So, like, for us in the digital healthcare, we can look at the sustainability from the use of virtual care. So what we have done here, we have actually presented the telemedicine, which is the teleconsultation that happens online. With that, actually, we have contributed in reducing the carbon emission in the UAE itself. And that is actually an actual project that happens within EHS. So when the COVID happened, we have actually converted a huge number of visits to be virtual. With that, when we calculated, because we have actually introduced a tool to measure the carbon emission depending on the type of the vehicle that the patient is using, plus the location from where he is to where he reaches, we've seen that we have contributed, in a reduction of the carbon emission hugely in the UAE itself. This is one part of it, but there is another areas like, introducing that all your medical records can be, electronic. With this, you are actually doing a huge
paperless strategy.
Paperless strategies that we're having. And we have actually succeeded in the UAE to do this paperless initiative. And we have reached, like now, currently, we have our unified medical record for the whole United Arab Emirates. So all the records of the patients and the customers within the UAE are all under one platform. And like you see in Abu Dhabi, they have the initiatives which is called Malafi. In Dubai, they have initiatives which is called Nabad. And then we have the overarching initiative which is called Riayati. And for all these three of them, they all actually share the information of the patient's records, whether it was in Abu Dhabi or in Dubai, and all we have under one single data repository. And actually, that is a success that I can say it's huge. It has a huge impact in how the healthcare services is being delivered in the UAE. So, I mean, that's are the areas that I can see there would be a great potentials if we use it to have, a major impact on how we can do the reduction of the carbon in the UAE itself, and be part of the sustainability plan that is happening in the United Arab Emirates.
Dr. Mubaraka Ibrahim, CIO of Emirates Health Services, thank you so much for your time at CIO Leadership Live Middle East.
Thank you very much, Andrea. Thank you.